So the policy crisis in question for this board in this meeting is this. How should governments, business, and international organizations allocate and distribute pandemic antivirals and medical supplies to the people who need them most? We now have time for discussion about this matter. This is the focus of this meeting. Any reactions? We have too few antivirals for the needs that we have, and we're projecting to have increasing needs. So should we let normal suppliers and buyers manage the distribution and allocation of this medication? Should governments step in? If so, with what rules? Steve?
Yeah, let me start by saying it is fantastic how much has been learned about this disease in just the short period of time since its discovery. I think one issue that hasn't yet been explored is what could be done to suppress transmission apart from the use of countermeasures. And so I think that's something that needs to be an active area of study. Learning where transmission is occurring would be helpful in order to implement measures that don't require medicines to suppress transmission. Maybe hospital settings, school settings are places where transmission could be occurring. With regards to the question of sharing this scarce resource, we do have some models that I think could be built upon. The PIP framework, the things that were done during H1N1 to share vaccine. I think each of those models should be explored as ways of some sort of distribution process. One of the specific things that was done during H1N1 was to examine the critical individuals in countries as a sort of a minimum level of countermeasure that would be needed, and to
So do you mean critical infrastructure?
Exactly.
Critical infrastructure in countries going?
Security, police, fire. What number of treatment courses? If we had enough to share, what would that minimum number be, just as a starting point for negotiation?
Great, Adrian. And then
I think before we agree that we have a finite resource, we need to really challenge ourselves on the vaccine production. We've seen historically that we can actually produce an Ebola vaccine in a year. It requires flexibility on the regulatory side. It requires commitment from companies. But I do think that before we say that a vaccine is not available, we should not slow down on that. We should pursue that. And I think similarly, we need to explore how could we accelerate production of our antivirals. We've seen it happen before in the HIV crisis. It's possible, but decisions need to be made, and we need to bring the right people together to do that.
Okay. And for the moment, before we are able to accelerate production of the antiviral, do you have any initial reaction, since you are potentially one of the companies that could be part of this deliberation?
What we've seen work very well in the HIV field is, in fact, procurement through the Global Fund. So having a centralized mechanism, so financially able to procure on behalf of affected countries would be critical. I think the second thing is it's going to be very important that for the business sector, for manufacturers of antivirals, that we have clarity around what the need is and where the need is and who are making the decisions.
So who's deciding on where they're going?
So can I add to that?
Yes.
So one of the challenges we have is what to do in the really short term about the supply of vaccines, antivirals, etc. Because low to middle income countries will be concerned that the entire supply chain will be tied up by the time they can even figure out how to finance their purchases. We know, and we know this from what happened with H1N1, that if you can stop something early in terms of everything from ring fencing in particular countries, but also to look at the transmission from country to country, and there's a variety of measures that can be taken to do that. But unless that is done in a global context and it's done very early, we will end up with a situation where the entire supply chain will have gone. So what we need to do at the very outset is figure out what the likely route of transmission is and move very quickly to secure supplies and distribute supplies according to whatever epidemiological protocol and based on what Steve says, as we know, we already know some things about the transmission of this disease. But unless we do that whilst doing what we can do on vaccine, I agree, we will have this get out of control.
Okay, Tim.
I agree with
Yeah, we'll go down the line.
It's important, and it's fantastic to have this information in front of us, because if you look across the countries, you've got very different patterns already. Chile seems to have a 3% case fatality rate, Ecuador a 5%. So what's going on there, and are there lessons in terms of how they're managing the outbreak, which might inform ways in which you're going to decrease the need for scarce resources? Are they more effective in their supportive treatment, or what is it that's explaining what look to be significantly different patterns in the outbreak of the epidemic? The second point is that these are all middle-income countries or high-income countries, and as Jane mentioned, low-income countries are either their surveillance systems aren't sensitive enough to detect cases that are already there, or are worried that, in fact, they will be at the bottom of the food chain. And in this respect, the World Bank would probably be proactively moving into exercising what we call a CERC, which is a contingency emergency response component to existing loans to low and middle income countries, in which they can repurpose those loans for these types of emergencies. So I think on the financing side, the CERCs, which are built into every loan made by the bank, could be exercised in such a way that you don't have the problem of the lack of resources being the primary constraint for the purchase of those scarce commodities.
Okay, Latoya?
I agree, because financially, that's one of the things we'll have to look at. We have to have the financial means to start production, mass production, and getting companies on board. It's about buy-in and having an understanding of where we're moving forward with this disease process, how quickly and rapidly it's proliferating, and also utilizing the materials that we do know, like the protective equipment that we already have. We know it's airborne, so ensuring that companies that are manufacturing these products have the financial ability to be able to do such. So that way, even if we are in the process of continuing to develop this drug, there is some type of protection that's going on to the lower companies.
Great. So I'm going to keep going down the line, but just in terms of the initial reactions, do we think, as Adrian suggested, that there should be some kind of international resource or distribution method, or really is this going to be every country for itself doing what it can to procure N95 masks, antivirals for itself? And so just think about that as you're making your comments. Yeah.
Well, I do think that there needs to be sort of an honest broker, a centralized command and control organization that really brings together the public-private sector, both on a global approach and also on a local approach, because we can't forget that transparency and communications at the local level are going to be critical in the to stop the continued spread. But I do think there needs to be some form of centralized approach to really organize all the various efforts that are going to be undertaken.
Okay, I think a lot of people want to get in here. We'll go around the table. Martin, Sophia, Chris, and then George.
Thank you. I fully support the centralized approach in this state we have already, if it comes also to global distribution of any products. And I would like to go back to Stephen's first statement. We had parallel to this, we should really focus on how this spread could be controlled better or easily. If I talk about logistics for globally distributed topics, we need to protect the staff that is responsible for this. If they don't protect it, they won't do this. And then the entire chain breaks apart within no days. So we really have to do both parallel to find out possible ways to protect the people that are enjoined for this, and it should be centralized, organized, otherwise it will not work.
So you're saying that the people who are delivering these medicines and moving them around the world, they should be protected
Yes.
by these medicines,
Yes.
the N95
I
masks?
mean, there's basic protection anyway in a phase like this, but we should enlarge this with the newest information we have about the spreading. Only with this we can guarantee that any distribution is possible at all.
Okay, Sophia?
Thank you. Yes, I agree. And I wanted to speak to the point about having the honest broker. And I think in this regard, the United Nations fits the bill. I think that given that the countries most affected are those that are low and middle income countries with unequal access to technology, to finances, the UN has a worldwide footprint, universally recognized, and universal membership. And I think taking the example of the Ebola crisis last round, when a trust fund was established, and calling on member states who are capable of contributing to that trust fund in order to help those that are least capable, the low and middle income countries. Thank you.
Chris?
Thanks, Tom. I want to agree with a couple of comments. One is about the need to prioritize for the frontline health workers, the basic people to keep the system working. I think it's important to recognize that we have the data that you're showing because of some remarkable international collaboration about sharing information in real time about the patterns of disease. And that's come out of the international health regulations, and that's a good first step. If we're now going to try to prioritize the allocation of scarce commodities, having this kind of dashboard to know where those masks and drugs are, and to get at some of the psychology that's behind some of the hoarding. People may be making bad decisions because they think it's more scarce than it actually is. So if we could have the equivalent of this dashboard to understand where the supplies are to map to the needs, a global stockpile would certainly help ensure more rational and strategic allocation. But the reality is that we don't have the logistics capability, even within the UN, to bring that together in one place and run it. So this is where I think a collaboration between the international organizations like the World Health Organization and the private sector, which runs these supply chains for many purposes every day, understand where the supplies are, make smart decisions about how to allocate them to the people who need them in the places that need them the most, and then work with the industry to move those supplies from where they are today to where they need to be.
On your point of transparency and data about where supplies are, where medicines are, where N95 masks are, we couldn't agree. We've been unable to find that data, so I think it's an important need that you just surfaced. George?
Yes, I would support for the proposal, centralized, coordinated effort, not just nationally, also internationally. At such a situation, that's very, very, very important. And when you read all this about the epi data, R0 is 2. It's relatively, you can see the number is there. Especially when you are talking about some country like China or any countries who have the largest population of the swine, pig production. So if the virus yet still, transmitted from pig still in the cycle, so that could be very serious. So we have to prioritize. So maybe the farmers or whoever have access to it. So that's very, very important to have the expert to assess the possibility. You see the R0, but you also see it's swine origin. I will still have some new virus from pigs, or the virus already circulating in the human beings. That's also, we should put that into account for the strategy for the allocation of the actual winner. And also I got the information from my staff, looks like, of course, we have capacity to produce the actual number, but even, think about the population we have. We can't expand our capacity, but, what we have, even not enough for our own population. That's the question we should think.
Yes.